So as with each board meeting, we have the opportunity to hear the story of an Ohioan whose life was impacted by substance use, embodying the spirit of Together We Can by dedicating their work to reducing stigma and providing support to save lives. Growing up in Northeast Ohio, Blythe Barno lived in a household impacted by substance use. As a teenager, Blythe had many friends who used drugs, and at just 15 years old, she experienced the loss of her first friend to an overdose. A few years later, Blythe lost her partner to a fatal overdose, and at the funeral, the family's pastor condemned her partner for using drugs. In the next year, several people she shared a few with that day died, leading Blythe to understand the deadly consequences of shame and stigma. In 2005 alone, Blythe lost 8 friends to a combination of war, suicide, and fatal overdose. These tragic experiences shaped the work that she does today. While working as an advocate for survivors of domestic and sexual violence, a mentor of hers introduced her to harm reduction. Initially opposed to the concept, her perspective shifted after attending her first harm reduction training, where she saw its value in saving lives and affirming the inherent dignity of people who use drugs. Since then, she has been dedicated to the mission. Working full-time in the harm reduction field out in California, Blythe felt a call to attend seminary. She wanted to learn how to bury loved ones with dignity and offer the spiritual care that her friends had deserved and were denied. More than that, she wanted to prevent the need from funerals from happening at all, blending her passion for ministry and harm reduction. As a minister, Blythe is passionate about equipping clergy to address substance use at both the individual and community levels. She does this by offering a Christian worship called Naloxone Saves, building relationships, understanding between people who use drugs and clergy, as well as offering training on the life-saving approach of harm reduction. Since returning to Ohio in 2019, Blythe has remained committed to the harm reduction movement. She founded HEAL Ohio, which stands for Harm Reduction, Education, Advocacy, and Leadership. Through HEAL, she created the statewide harm reduction policy table that brings together over 150 harm reduction leaders, clergy, people who use drugs, and service providers to advocate for change. Among other initiatives, they have fought to expand Ohio's Good Samaritan law, granting broader immunity for minor drug charges when an individual overdoses and someone calls 911 for help. They have also advocated for increased statewide access to naloxone and greater understanding of harm reduction. Thanks, y'all. Today, Blythe Barno is a minister, director at HEAL Ohio, and co-founder of Harm Reduction and Overdose Prevention Ministry of the United Church of Christ nationally. She remains passionate about meeting people where they are and helping everyone recognize their own dignity. Most recently, she worked alongside other harm reduction leaders to create DLSN, a deck of 52 solutions to inspire responses to the current crisis. Minister Barno wants people to know that harm reduction is a practical, loving, and common sense way to save lives and resurrect our communities, and that humbly working side by side with people who use drugs is key to our success. Thank you, Blythe, for sharing your story with us today. And with Overdose Awareness Day being just a few weeks away, we commend you for your continued work to reduce the number of Ohioans that die by fatal overdose. And so I think Blythe has something she'd like to say.
So just wanted to say thank you for the honor to share a little about my story. And we have some members of the statewide policy table here with us today. And in that brief blurb, we talked about DLSN, and we brought some copies for everybody. And yeah, that'd be great.
Thank you.
And this is, I put a bow on it because this is really a gift born of love and hard-won experience. So there are 52 solutions that community members are asking for in terms of funding from the settlement dollars that are coming in. And Ohio started, our policy table started to draft ideas of what is really going to save lives in our community. And we shared that with some national organizers, and they were so inspired that some folks made their own dream kind of list for their state, which then led to a national coalition being formed. And that national coalition put together the roadmap for settlement spending that we launched last year and just revised and updated and is launching today. So good synchronous timing. And you can read about it in the Washington Post. There was a exclusive that was published earlier this morning about our work. Just making sure that folks understand the value of the leadership of people who use drugs and how critical harm reduction is to really meeting people where they're at, giving folks the tools that they need to survive. A lot of the tools that we use now, naloxone and syringe service programs and fentanyl testing strips, all of those are really practical tools that people who use drugs on the ground were like, how do I save my life and the lives of the people that I love? And so we owe a great debt of thanks to those leaders who showed us the way. And this deck is created in their honor as well. So I don't know if any of you have things you want to share.
I just want to say, you know, this is a labor of love, and we stand on the shoulders of legends who cannot use their voice because there wasn't a response in time, and that the lives lost are why this opportunity is even here, to be restorative and radically accountable. And I challenge you just to really lean on your integrity and your love when making these decisions.
Thank you all. Add one more thing, I'm sorry. There's a QR code on every card and on the back, and it takes you to a website that we put together. So for every card in there, there's a link that will take you to additional research, programs that already exist, and leaders to know. So more resources online. Thanks again.
Thank you, and I'll say on August 31st, the Muskingum County Commissioners and the City of Zanesville are working together to light up the downtown as well as some bridges appropriately in purple. So we'll make sure we file that with One Ohio so everybody can come to Zanesville. But thank you very much for the special presentation. Next, I'm honored to introduce our special guest for today's meetings, who will talk to us about the importance of diversity, equity, and inclusion, particularly as it relates to mental health and substance abuse disorders. Not only is this the policy of ours, and we host training like this, we are also working to ensure that we're a key driver in this area. So with that, we are joined today by Erica Crowley, the Executive Director of the Multi-Ethnic Advocates for Cultural Competence, and Joan England, the Executive Director of the Mental Health and Addiction Advocacy Coalition. So thank you.
Thank you. You go down to go forward. If I forget that, I probably will. We go down to go forward. Thank you all for inviting us to come and chat with you. We could talk for hours about this, but we promise we will conclude in 20 minutes or so. So we've got a lot of slides to go through. Neither Erica nor I are going to jump into every single detail on the slide, but this deck will be available to you. And at the very end, we have a QR code that will take you to the reports that we have currently. So I am Joan England. Good to see all of you. I know many of the folks in the room. It's good to see your faces. We are, our organizations, along with two others that you'll see here, and I'll talk about in a bit more, involved in this project entitled Behavioral Health in Ohio, Improving Data, Moving Towards Racial and Ethnic Equity. There we go. Okay. So the report is coming out. Phase 1 is coming out in a series of 4 reports. 2 are already out. These came out last year. The first one is an overview of opportunities. The second one is opportunities for the workforce. Coming out this year are reports 3 and 4. 3 will look at funding when it comes to behavioral health in Ohio, and the 4th will look at opportunities for treatment and supports. And we're going to talk a little bit more about those in a minute. So, step back. Why did we do this? The example I give is a personal one. I've been in this position now for 21 years. And for 21 years, I have said our behavioral health workforce doesn't look like the people that we serve. And everyone will say, you are right, absolutely. 21 years. But if anybody had pushed me, even remotely, Joni, you talking about social workers? And if you're talking about social workers, are you talking about LSWs or LISW or LISWS? Who are you talking about and by how much? Are you talking about nurses? You're talking about LPNs, RNs, APRNs, and how much if we're off? We had no answers, none for that in the state of Ohio. There was no collection of all of that data when it came to workforce. That's why we undertook this report, to establish some baselines. We're doing all kinds of things at the state and local level, rightly so, to increase the behavioral health workforce because we need more people in this workforce, but we had no idea what our workforce looked like. And so that's why we did this report. And that's why we're looking at workforce, why we're looking at funding, why we're looking at treatment. And we'll talk about that in a minute. So the first thing we had to do was put together our team. My organization, Mental Health and Addiction Advocacy Coalition, Erica's Multi-Ethnic Advocates for Cultural Competence. Both of our organizations have been working in our spaces now for 21 years. Yep, absolutely. We are policy advocacy and research folks. Erica's shop brings expertise and cultural competence to the table. They were the first group I reached out to when I was creating this project. The third partner is Ohio University, and they are bringing their research institute to this project. They are bringing the firepower of that organization. The last, and I would argue with due deference to the rest of us, the most important partner on the project is Central State University. They are the public HBCU in the state of Ohio. They bring the expertise and the firepower of an HBCU to this project. We wouldn't be able to do it without funding. These are the wonderful organizations that have provided funding for this phase of the report, and we are incredibly grateful to all of them. All right, report number 1, overview. Goal for this report is to level set. Why are we talking about health equity? Why are we talking about social determinants of health? What are they? Why are we talking about systemic racism? And why are we talking about them all together at one time? That's what this report does. We make no assumption that anyone who reads this research will know anything about these things. We also assume that some people will know everything about these things. So report number 1 was to level set, bring everybody to the table, encourage curiosity. It also, in that report, as with all of our reports, included a series of recommendations. All of our reports include them, and 3 and 4 are no exception. We also importantly call out what data exists, and most importantly, I might argue, what data does not exist. No offense to the policymakers in the room, but historically, policymakers have found it incredibly convenient and opportune to not make decisions at times because there is not data available. We can't take action. There's no data showing the problem. We're calling that out in this report. If data doesn't exist, and it should, we call it out and we list it. In report number 1, we also note that national research shows that marginalized people face barriers to access culturally competent care, and they also face barriers from provider racial bias along with stigma. In addition, we know that, why are we talking about this? Racially and ethnically concordant services are associated with positive outcomes, better treatment adherence, better understanding, just better outcomes. This one is sobering, and this one, every time I list this, it brings me almost to my knees. From 2010 to 2020, there was a 14% increase in the age-adjusted death rate for suicides for all Ohioans. For non-Hispanic Black Ohioans, it was 87.3. 14% versus 87.3. What is going on? We also know now that Black non-Hispanic males now have the highest drug overdose death rate in Ohio. And you'll see where that happened. It was like about halfway through 18 into 19. That's when the surpassing occurred. All right, so let's briefly talk about report number 2. This is the one that's focused on the workforce. All right, we know the pass rate is much lower for Black test takers. It's clearly not because they're not as smart or they haven't taken the classes. There is something wrong with that test, and that is finally being talked about at the national level. Pass rates of 83.9 versus 45. What's wrong with that test? And let's get it fixed. Whoops, there it goes. All right, we know that about 12.5% of Ohioans identify as Black and about 4.5% as Hispanic. However, less than 5% of all psychologists are Black. 2.5% are Hispanic. Same thing with physicians. Less than 5% are Black and about 3% are Hispanic. Vast majority of pharmacists. We know how important pharmacists can be in communities, right? 87.2% are white, 3.5% are Black, and only 0.5% are Hispanic. And we also know that as educational requirements increase, Black professionals are increasingly underrepresented. That's what we saw in the data. This gives you just a quick overview of where did we get this data. So we worked with all of the licensing boards in the state of Ohio that license individuals that may provide behavioral health services. All right, so that includes the Ohio Counselor, Social Worker, and Marriage and Family Therapist Board, the medical board. And for the medical board, we didn't pull the data for all physicians. We didn't pull data on anesthesiologists or orthopods. We pulled those that might be providing behavioral health care. So certainly including psychiatrists, but also pediatricians, OBGYNs. So those are the folks that we looked at their data. The Ohio Psychology Board we looked at. Chemical dependency professionals we looked at. And these are all of the various professions that they license that are listed there. And the educational requirements that are required. Pharmacy Board, Nursing Board, and then Ohio MOS when it came to peer supporters. This is the chart that if you don't look at anything else, this is the one that, well, there's a couple things, but this one provides some incredibly valuable information. Along this left-hand column, you'll see the data source. So who is the board that we pulled the data from? Do they have a separate variable for race and ethnicity? What's the percentage of data that includes race? So were the respondents providing their race? Is the data at the zip code or the county level? And then this one, home or office location used. I'm going to come back to that one because it's a bee in my bonnet. This one is languages and service providers, right? Languages spoken by service providers. I'm going to come back to that one too. And then this is the racial and ethnic breakdown, okay? And then this is the percentage of zip codes that do not have any of these professionals. Look at the medical board, 45%, almost 46% don't have a doc in that zip code. Look at the psychology board, 64%. So let me come back to this home or office. Our position is we need data, but we need good data. We don't need garbage data. Nobody needs to provide garbage data. Here, home or office. Why does that matter? I'll pick on the social workers. They ask for home zip code information. I used my example, my personal example. My office in Cleveland, we have offices in Cleveland, Columbus, and Cincinnati. My Cleveland office is in the poorest, or one of the very poorest zip codes in the city of Cleveland. I live in an admittedly bougie little village where all the buildings are white with black shutters. I love it, don't get me wrong, but we have a hunt club with dogs, horses, the whole 9 yards. So what are we asking for? Home zip? Who gives it? Right? Hunt club? Poorest zip code in the city of Cleveland. Let's ask for good data in the state of Ohio so we can get to the bottom of the problems. And then this one, languages providers speak, counselors and social workers, missing data, 76%. There's no data. Same thing, look at psychology board, 90%. There's a huge swath of Ohioans who are not receiving care because English isn't their first language. Huge swath. Oh, here we go. All right, we did it for all those boards. Take a look at that. Heat mapped. See those in there as well. And then a series of recommendations. And we don't just stop with like these big categories of recommendations. We have sub-recommendations underneath it. And importantly, who should be responsible so that we can hold folks accountable moving forward. I'm gonna turn it over to Erica.
Thank you, Joan. And let me just say, I am the new executive director for MAC. I've been there 6 weeks. You in this room know me because I moonlight as a county commissioner here in Franklin County, a former legislator. And so this is near and dear to my heart, and happy that I get to cover the recommendations because some of these things I know policymakers have been working on, but with your support, maybe we can get these things implemented. So when we look at the recommendations to achieve increased equity in the medical training, healthcare delivery field, we know that we need to be promoting equity because it decreases costs, provides relief in all systems, reduces return visits, as well as just delivers better outcomes. And so when we're thinking about just the knowledge, we need to review textbooks with diverse panels of authors, physicians, nurses, healthcare professionals to eliminate inaccurate and false and biased information. We know historically that some of our textbooks don't accurately report how Black and brown or BIPOC individuals receive care, or that sometimes Black individuals have different pain tolerance and things like that. We know historically those things have been a problem, and we know we can rectify that. We have to be intentional in recruiting medical school candidates, reaching out to HBCUs. Some HBCUs have medical colleges, but we know that historically, when we think of predominantly white institutions, we are not being recruited into nursing fields or into medical fields in a way that we are at HBCU. So there is a whole pool of candidates that can be tapped into and should be tapped into. There we go. So we have to be intentional about selecting candidates for specialized rotations and programs as we think of specialties, as Joan went over, and be inclusive in mentoring programs. Also, we need to actively promote diversity within medical workforce. We know that when we have practitioners and clinicians that look like us, that we have better outcomes. When people understand exactly the environments in which we come from, the trauma that we might have experienced, or how trauma is passed down, we have better outcomes. Also, ongoing cultural competency training in the healthcare profession is a must. We also know that when, especially we go into a healthcare field or go into hospitals that don't treat everyone fairly and equitably, we know that when it comes to cultural differences, whether someone might be Muslim, sometimes they cannot come into, a woman can't be in a room with a doctor by herself. Understanding those things makes a huge difference. But we also know that in the healthcare field, that for nurses and doctors here in the state of Ohio, having anti-racism training for CEUs is not a requirement. And we know that if we did have that in states where those things are implemented, there are better outcomes. Also, if we just recognize and address implicit bias that might affect medical decisions and interactions with patients, better outcomes. And I know these are things that we already know, but we see that there are still challenges in access to care. Hospital systems should do periodic assessments to identify measures and remedy disparities in treatment and outcomes. I know that in Cincinnati, and I know my colleague, County Commissioner Driehaus, probably is well aware of what is happening down there with Cradle Cincinnati, as well as Queens Village, where they are assessing, or patients get to assess hospitals and the care that they receive. And that has shifted the narrative around the state. And if we could get the hospitals on board, or the hospital association, to understand how people are reporting their care, maybe they would implement some of these things that we are saying hospital systems should do when it comes to care that they are providing to their patients. Let me go back real quick. I think it is important, we have to collect demographic data on patients, as Joan said, data, but we also need to be understanding veteran status, or as we have people who migrate here from other countries, what does care look like for them, and disparities in how things are different in their home country, and then when they get here, how they can experience trauma. We're gonna beat this horse and continue to do so until we make sure that everyone has access to language services. As you saw the data, a lot of people are not English speakers as a first language. Therefore, when they need access to care, we have to have interpreters, translated materials, and bilingual staff members that can help address the needs of the patients. And when we talk about translated materials, we're not talking about where people go to Google Translate, because that doesn't work all the time. We have seen that. My organization has seen that in contracting with an organization to provide language materials, where those language materials, we had to contract with someone else because it did not translate right into the language that was needed. So that could be problematic. Implement strategies to reduce financial barriers so we can have access to care and more access to care. We know that if people can't afford it, they're not going to go and get it. And if they have to make decisions between care and keeping a roof over their head, water running, lights on, they're going to forego care. Ensure research studies are inclusive of diverse populations. We heard about this during the pandemic, how when there are studies that happen, a lot of times BIPOC individuals are not part of those studies, and therefore the research and data may not be as accurate as it could be. Collaborate with policymakers and advocate for policies to promote health equity. Senator Tavares, when she was in the Senate, in the state Senate, put forward health equity in all policies. That did not move forward. When I was in the legislature in 2019, offered that legislation, and then again in my second term, and that did not go anywhere. When we think about health equity in all policies, we're looking at the policies that we implement as decision makers. Does it have a positive, neutral, or a negative impact on our individuals? If we're looking at changing the requirements for certifications for different professionals, how does that impact individuals? Health equity in our policies, or policies that promote health equity, we know at the end of the day, make sure that we have that outcomes, and one, save lives. So I will turn this back over to Joan.
So wrapping up here, 3 and 4 are coming out this year, so watch for them. Whoops, I went backwards. 3 and 4 are coming out later this year. Again, funding, treatment, and supports. We are looking at a whole, I know I've got some Adams Sports directors in here. I'm grateful to all of you for responding to surveys that we've sent out. That will be in report number 3. Report number 4 is going to include a whole bunch of data, primarily from the Ohio Department of Medicaid. So we're slicing and dicing all of that, so be looking for that as well. You can see we asked for a ton of stuff. We talk about in our reports various learnings that we came to, and you can see that in the report, and we're happy to talk about those as well. Phase 2 has started. It's qualitative research on the workforce issues, same 4 partners. And then finally, let's see, we get, this is all addressed in the report too. And there's the report. So if you are interested in reading the reports, you can scan that QR code. I know both Erica and I would welcome any questions from folks or an opportunity to come and present to your organizations. Grateful to all of you. Thank you for the work you're doing. Want to go back?
Yeah. And the QR code works.
All right.
Yeah, you never know where it takes you.
I feel that.
But seriously, thank you so very, very much for the presentation. Next, I'd like to move to our grant update presentation by the Grant Oversight Committee Chair, Tom Gregoire.
Alrighty. This is a day, we won't have another day like this. This is the first day we're going to approve and later funding and move it forward. And I just want to, I want us to not forget that day. I want this date. Years from now, we'll still be giving out money and we'll still be changing lives, but we start today. And so I'm really proud of that. I thought about counting how many grant committee meetings we had, and then I thought I didn't want to know. I want to acknowledge the members of the grant committee, and would you please raise your hand if you're in the room. This group has been meeting twice a month for our entire life. And they've done a lot of good work, and I'm really proud of that. And the staff have designed a really effective process. So,
Mr. Chairman, can I make
yes.
a quick comment? I just want to acknowledge Tom because he's the one that really did the heavy lift. And, you know, throughout the whole process, and he was, you know, very persistent in making sure we get through this. And so, you know, as a board, I think we should thank you for your hard work. And really
I appreciate that, and I assure you that this was nobody lifts this by them, especially this scrawny old dude. So, yes, thank you for that, but it was a team and staff lift. So anyway, I'm going to stop there, but it's a really meaningful day for us, and I'm very excited about that. Proud to be part of it. I'm going to turn it over to Alicia and Sarah for updates.
I will give you an update on where we are with the regions and then some high-level process details just to give you a little more visibility into where we are. So now we announced at our July board meeting that 100% of our regions were reviewing grants. I'm excited to share that 5 of our regions have completed their review and sent their recommendations onto the foundation. And perhaps maybe by the end of this meeting, we might have a 6th region. So things are progressing nicely. And as just a reminder, our first region began reviewing May 28th, and then our final 3 started reviewing in early July. And most regions have set a deadline of sometime in either August or September to be done with their review and sending in their recommendations. So this is, we've seen this a number of times, our 6-step kind of steps to the grant review process. We are done with 1 and 2, but I will talk a little bit more about 3, 4, 5, and 6, because that is where our regions are, and also give a little more context into what goes into each of these, because they're not that simple as it may look. So we'll be looking at this slide a lot moving forward. This chart, it is updating daily. So across the top, we have our regions 1 through 19. And then on the far left-hand side is the 6 steps, but I started at step 3 because we're done with 1 and 2. And then we gave some more detail, 3A, we got the feedback from the region, right? That means the power user submitted their recommendations in the grant portal. 3B, that means the foundation staff is doing the budget review process. So giving you a little more about what all goes into each one of these steps as we move the region's recommendations along this process. So regions grants can be in multiple stages at a time. So we have that noted up here. And like I said, we'll be updating this on a weekly basis to keep you all informed on where the regions are with their grant recommendations. So this is probably already out of date with the region that is meeting right now. So good problem to have. And I know this is a screenshot from the quick guide to the regional grant review process that I know we've looked at before and we've shared it extensively with the regions. But this is the process that we've applied to all 19 regions to maintain that fidelity to our process and consistency to how the process is done across all 19 regions. We've met with all 19 regions, their leadership, to deliver what we call the grant summary package, go over kind of final reminders, have the conflicts of interest discussion, and then we've been going to all of the regions' grant review committee meetings and then their full board meetings to be there as support. So it's been great to spend so much time with the regions, learning a lot of things. And this is, it's a big network. I can proudly say that pretty much all 333 of our region volunteers completed the related party questionnaire. I think we had like a 96 completion rate. So we have a huge number of people participating in this grant review process at the regional level. This is the region-related party questionnaire that all 333 people had to fill out, where they listed the organizations that they receive compensation from, and then the organizations that they are affiliated with. They also had some statements that they would attest to, right? That they participated in our grant reviewer training, they took the ethics training, maintained confidentiality, follow our process. So they all attested to that in that related party questionnaire. We use that information to make a conflicts of interest summary sheet. So it's real easy as we start discussing grants to know what needs to be disclosed and then recused from. We made a SharePoint site for every region for the regional grant reviewers that houses the conflicts of interest summary sheet, as well as their regional grant summary report, and then all of the resources that we have created for the regional board to help support them in this process. And what was great about us being so engaged in the regions is that in real time, we could provide new resources based on needs that were coming up. So we created template meeting minutes, grant review meeting guide, and an acronym sheet. Actually, that was requested a number of times, some commonly used acronyms from the behavioral health field. So we've been able to make improvements and provide more resources in real time. So now I'll turn it over to Alicia.
Certainly, and I think it's important that we shared that process with you. I know a number of you who are region representatives have seen that, but for our statewide folks, this is your first time really seeing the work that went into the process. Most importantly, to avoid conflicts and to support the regions in a way that the applicants should feel good about. Applicants should know that the fidelity was followed in this model. And that we look for those conflicts, whether actual or perceived, and remove those as we went through the process. So we really hope that applicants feel good about this process, and having this many people involved has been great. I want to spend some time talking about step 6, and we will hit step 5 today with our grants committee, and we continue to do so with the grants committee as they review the regions as they come in. But today we'll spend some time talking about step 6 and what all is a part of that process. So I think that this is going to be different than what many have experienced when it comes to grant awards, grant announcements and things. And so we thought it important, just like we did the regional process, we talk about what's done after the vote today so that folks can have clarity, you all could have clarity, and then give us any feedback that you may have on the process. We anticipate that we will have hundreds of grants that we will be approving through this grant process with our regions and recommendations. Though that information is going to be coming to you all, and you should have received your packet for the first round that we'll talk about here today. Once you all approve an up to amount, award amount today, we will start a process that follows. What is key is you'll see the end of this process is the actual award announcements. And so we'll just take it step by step. With your board approval today for up to funding award amounts, we will take that information and go work directly with the foundation, will work directly with the awardees in this process. That will really start to work through the budget negotiations. As you know, we had over $500 million in requests and only $51 million to spend. I can't say that enough. People and groups will get partial awards likely in this process. And so we will start those conversations with those potential awardees to make sure they're okay with the award amount and feel like they can move forward based off of the award amount that was granted by the region. If they're okay, they'll move to the finalist verification form where we will collect an updated budget likely because that budget has been reduced. What are your new outcomes? How many people do you expect to impact with your budget, new budget amount, and any other relevant details, including, have you been funded by others? Our application was due in May. It's now August. I had to think about it. And so have you been awarded through the capital budget? Have you seen some of the federal dollars that have been coming out? Et cetera. And so we will collect that information and really work with that organization to do our grant agreement. And once we have that contract between the application or the applicant, which will now be our awardee, and the foundation, once that's executed, then we will do an award process and come back to you all and say what the name of the organization is that received the funds, how much they received, and tell the world a little bit about the program that got the funding. So today, we will award an up to amount likely, if you all approve, but we will not be announcing names of actual organizations today. We'll do this process with them, make sure they feel good about the amount they'll be receiving, feel good about the award. And as soon as we get those contracts signed, we will do award announcements. We're going to be working later today to figure out what that looks like. And we'll likely do those award announcements in between meetings via press release and other means. So we're really excited about the process. Does anybody have any questions? I know that it's a little different than maybe other groups, how they fund, but we think we would do.
Yeah, and I should have asked this in the grant committee, I didn't think of it. So the second one, the budget negotiation, the One Ohio staff, and again, you've laid the context, some recommendations will be for less than what was applied for, right? So there's a reduced amount being potentially given to that organization, but not all the organizations. Some of them are getting what they asked for. And so I think the language there, Ohio, or the staff working with the other to reduce spending, but not always. And so I want to acknowledge that maybe in this language that may apply or it may not apply to some of those that are receiving dollars from the foundation.
Would you like it to say something more like One Ohio staff will work with applicants with
Without reduced spending if applicable.
Yeah. I think that's accurate.
Yeah.
Thanks for that. Any other questions or feedback about the process? So with that, we also wanted to just make a statement. I know a number of you received a survey from Sarah and Lori about the 2024 related party questionnaire. We promise we'll change the name of it next year. It's confusing to have two related party questionnaires floating around. But the auditor did our related party questionnaire for 2023. We found the need to do another related party questionnaire for this grant round because folks have changed, either jobs or circumstances have changed, looking at 2024 to make sure that we reduce or remove any actual or perceived conflicts in our 2024 grant process. So we're going to think of process improvements for moving forward, but we do need that second survey from all of you. I know a number of you have already submitted that, but if you haven't, please do so. And really listen as we go into executive session to talk about these grant awards. Listen for conflicts either way. If you've returned it in or not, if you have a conflict, please recuse yourself. Just like we're asking the regions to do, we will hold ourselves to those same standards and make sure that we are avoiding conflicts throughout the process. So, Dr. Roizen.
Question, can we get the 2024 again? Because since I thought it was the same one, I trashed it.
Thank you, Dr. Rosen. We certainly can get that to you. Again, apologies for the confusion in the process. Okay. So before we go into the executive session, I think we wanted to turn it over to Laura to walk through a couple of the details that we think we can share about Region 10.
All right, we just wanted to give a brief overview, help remind everyone what region we're discussing today, Region 17 in the north of our state. We have the counties that are impacted in this region listed here. And we just wanted to share a little bit about what they received, a total of 51 applications. The region has recommended 18 of them for funding. However, today you're only looking at 8 of those 18, and that's simply because the grants committee didn't finish. So, and they actually were working on that at the meeting prior to this one. So you will see more of Region 17's recommendations coming in future meetings. So no special reason that these 8 made it and the others are being discussed later, just that they hadn't completed their review. So we have a total recommended amount of $1,608,771 recommended from Region 17. And here is a breakdown of that funding of the 18 recommended projects. Their funding, this is by abatement strategy. So their top 3 funded abatement strategies are prevention, treatment and healthcare services, and services for impacted children and families. So we'll keep updating you with slides like this so that we can see the impact of all of the regions together and where the funding is really going.
And
For
with
the
that, I
8
think-
or for the 18?
So the chart was for the 18. That's the 18 that all came out of the region.
Gotcha. So it's actually a smaller amount of funding. Will we
amount
be
that's being
voting on
discussed.
today?
The amount today is smaller, correct?
And this will be a rolling process. So I know we have over 150 people kind of with us in our meeting, watching and following along. So, you know, this is a rolling process, and as we get applications complete, we'll get them in review complete. We'll get them in front of this board, and we'll have more to come about how the announcements, award announcements will be made. Everyone included, all applicants included, will get a notification of you're a finalist. Eventually, you'll get a notification you're a finalist, or you were not awarded funds at this time. So, you know, through the next 3 months or so, this will be the process that we'll take, and folks will know where they stand across the state. So with that.
Thank you very much. And after the executive session, you have a personnel committee and the executive committee, both by Director Amon. So with that, I'd like to have a motion on the floor to go to executive session for purposes of grants and contract negotiations.
So moved.
Motion by Greta. Second by Tom. Sorry, I'll give it to Tom. We have to have a roll call on that, please.
Director Amon,
Yes.
Director Whiston,
Yes.
Director Andrew,
Yes.
Director Mason,
Yes.
Director Mayer,
Yes.
Director Luce,
Yes.
Director St. John,
Yes.
Director Worsbicky,
Yes.
Director Dodge,
Yes.
Director Drehas,
Yes.
Director Hohato,
Yes.
Director Mattia, Director Picarilli, Director Greta Johnson,
Yes.
Director Silac,
Yes.
Director Gregoire,
Yes.
Director Kidd,
Yes.
Director Royson,
Yes.
Director Baker,
Yes.
Director Kleemeyer,
Yes.
Director Terry Johnson.
Yes.
Okay. We are hereby in executive session starting in about 2 minutes.
And we'll get the slides up momentarily. Thank you all for your patience, and I know we have still just a few more things to get
Just
through
a few.
today. So we'll have the slides to support us here in a moment, but we can.
Okay, so we've been through the 8 grants, and I would like to have a motion to approve the 8 grants recommended by Region 17 in the amount of $936,709.
So moved.
The grant committee, I would move to approve 8 grants from Region 17 for funding up to $936,709.
All right, we have a motion from Tom Gregoire. Is there a second on that?
Second.
Second.
Dr. Arkin.
You're there.
So we look forward to connecting with these organizations. Well, I guess we better, everyone please say aye.
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 Is anyone opposed to this? All right, we have approved grants.
Congratulations.
Jealous. We'll be shortly coming up with those. So we look forward to connecting with these organizations and confirming their grant awards, as Alicia has discussed. Once we have the grant agreements signed with these grantees, we will be sharing more details about the organizations that have been selected about their projects. So now I'm going to give a report on the executive committee that met. We have a few updates. The first was a discussion about board vacancies. And after discussion at the executive committee meeting, we would like to recommend that we add language to our code of regulations that would allow us to ensure continuity. And we would recommend that we pass a motion that a current director be allowed to continue service after the expiration of their term until such time as a replacement is appointed in accordance with the appointment process in our code of regulations. And so the language should be on the screen. This is not a forever carryover. We did specifically discuss that we did not want it to exceed 3 months, but sometimes regional boards have difficulty finding someone, have difficulty meeting, and we would like this board to not have 7 people show up at some point. So we thought that this was good language to add. And is there any discussion or thoughts on this?
I'll make a motion.
Larry would like to make a motion to allow the directors of the board to continue service after the expiration of their term. Second. And a second by Jeanette. Any further discussion?
I have a question.
Yes, sir.
We have limited terms, correct? I don't have the policy in front of us, but we all have limited terms, correct or not?
Currently, you do not have limited terms. You can serve.
Unless your region has said that, this board does not.
Oh, this board is not. Thank you for the clarification.
Thank you. Okay. So there's been a motion and a second. All those in favor, please say aye.
Aye.
Is anyone opposed? All right, the motion carries. The next item was discussing a special board meeting. And, you know, we want to have as few board meetings as possible because we understand of everybody's schedules, but we want to approve funds to meet our community needs too. So we would like to continue this process to approve the grants. And we would like to do several regions at each meeting, but we'd like to have an additional meeting so that we can continue this process. And we're looking at adding onto our calendar an additional virtual meeting on or around Wednesday, October 29th from 10:30 to 12:30. And so we're going to send out a notice to everybody and ask for your input on whether that or the other date that's given out will work. And we'll do what works best to satisfy a quorum on that. So just know that that will be coming and please respond to your availability. Finally, regarding State Fair Partnership, this is exciting. The Executive Committee had the privilege of hearing a partnership proposal on this year's Ohio State Fair with the Ohio Opioid Education Alliance. And through this partnership, we were able to have a presence at this year's State Fair and engage with thousands of Ohioans and talk about the importance of addressing stigma and the work of our foundation. So it was the Beat the Stigma program. Yeah. Now I'd like to move on to, kind of moving out of order, but the July financial report and turn it over to Jim.
Sure. Thank you. Take a few minutes this morning to recap foundation finances as of July 31st. All right, so foundation expended in the operating budget, not 94,000 in July, which has been about the average that we've been spending a month. Which brings the total to just under 600,000. We have 69% of the budget left for the remaining 5 months. So the fiscal year ends December 31st, 2024. Go on to the next. The grant budget spent 39,000 in July for a total of around 150,000, which puts us at 58% of the grant support budget. So we're spent a little bit more in that area than we have in the operating. In the next few months, we'll start seeing numbers based on your decision today and in future months in the following column, so that will be exciting. Move on to the cash report. So there's been lots of activity around our cash. So on July 31st, we received many payments from the National Opioid Administrator. We received our distributor year 4, 21 million for our distributor year 4. And we received earlier than we expected. That payment was on time. That was on the scheduled date. Earlier than we expected, we received the Walmart, Walgreens, CVS, Allergan, and Teva payments. All those payments were within our estimates except for the Walmart payment. And the Walmart payment was quite a bit more than we were expecting based on the agreement that we had seen a year and a half ago. So the agreement now has a shortened lifespan of 6 years. And so we talked with the National Administrator just yesterday to give us an explanation of what's happening with the law. This amount looks like it's about 90% of our total payment from Walmart. So we're trying to figure out if our total payments, what we might expect. So we're not sure. We'll connect next month on that. And the new item that the executive committee just talked about, the State Fair Partnership. We were the fiscal agent for that agreement. We received $150,000 from the Nationwide Foundation. And we're dispersing funds. We dispersed $43,000. The pay bills, as pay bills come in for those activities, we'll disperse it out of that line. Does anyone have any questions?
So that's our first foundation grant then, the Nationwide Foundation?
Nationwide Foundation, yeah.
I was gonna bring this up under new business, but while we're talking about grants, some of you may have seen the news yesterday that Yost's office settled with First Energy for $20 million for the House Bill 6 scale, and the money has to go to a non-energy related nonprofit. So I would suggest that our leadership team do some investigation and reach out to them about the work we've done and how this could affect Ohioans if we received the money.
That's a good comment. I know we, in a previous meeting, had asked him to attend, so I know that's still on the table that we'd like him to be here. So we'll see what we can do. Yeah.
So I should note for those online that this report is available on our website under meetings, board materials, and also in the onboard.
Great. Thank you, Jim.
May I just add, should we publicize the first grant from a foundation and maybe send it to the other foundations in Ohio as well? There's a list of, I'm sure that we can get a list of all the foundations, 501c3s in Ohio. It's kept by the Secretary of State, I think. And we should just send that out as a notice, a press release, if you will.
I think us behaving in a foundation recipient manner is a big topic for future discussion.
So, and we can look
Because
at
I've talked to Lish about it a little bit. She's probably sick and tired of me talking about it, but. All right. Thanks so much, Jim. Can we have a motion to approve the July unaudited financial report?
So moved.
Thanks, Jeanette. Second?
Second.
Second by David?
Sure.
Okay.
No, it was
Keith.
I missed him. I'm sorry.
Keith, it's all right.
Your ventriloquism was working really well.
That'd be frightening for Dave.
All those in favor, please say aye.
Aye.
Is anyone opposed? Okay, motion passes. Then the next thing on the agenda is a report from the Personnel Committee, of which I get to chair. And I would really like to say that this committee is small. So if you are not on a committee and you'd like to be on one, just speak to me afterwards. We'd love to have you. We have been in the process of going over the personnel handbook and going through some different updates. So it's on track. We're moving along. So that is all good news. There was a request from One Ohio for a staff request. And as we look at the long-term organization of what we're going to look like and what kind of staffing are we going to need and what does that do to us in the short term, we were requested to look into a grants associate to work under the grants manager. And this would be to have technical assistance to the applicant, someone who would keep records, someone who would create reports and work on analyzing data. So the personnel committee was positive to that idea, and so Alicia is working on that. The second thing that we looked at was an HR vendor group, an accounting firm to help us with our ACH processing. And the entity that she's been currently utilizing is more for big entities, and we need something that's a little bit more focused on our small group of employees. So that is what the personnel committee worked on, and we continue to meet pretty much on a monthly basis as well. So if you're interested at all, please let me know and we'll get you on the calendar and get you invited. And that's everything from the personnel committee. I think we're to the end of our agenda, guys. Let's see. Our next meeting is Wednesday, September 11th, right here, and we'll be meeting at 10:30 again. Our speakers are gone, but we appreciate Erica Crawley and Joan Anglin for coming in to help us understand health and racial and ethnic equity. Is there anything else for the good of the order? David?
You made mention that there was a recommendation from staff for a grants
Associate.
Is there an actionable item with this group to make that happen, or is that already approved through personnel?
We approved it in personnel.
Okay, thank you.
We're in the middle of, looking at all the grant applications, a lot of work, but, at some point, we need to talk about next year. And I'm just wondering when we're going to have that discussion as to
As for the budget allocations?
budget allocations between local and state, if any. It's not, time's not right now, but hopefully before the end of the year, we'll have some discussion on that.
Well, hopefully we can get Mr. Yost in here to talk about some of the ideas that he has had with the state funds. And then we also want to put it on our agenda, I believe it was October or September, that we're really going to talk about the regional numbers again and how as we look at the budget and what we need to spend on our operations, what the regions will be looking for in grants next year and what other ideas we may have. So that is very much to come, and we want to make sure that we spend the right amount of time on it and not just try to whisk through it because it's very important.
Thank you.
All right. Anything else for today? Don't see any hands raised up there. Is there a motion to adjourn?
So moved.
Second.
All right, thank you, guys.